Good morning. This is Steve Stites, Chief Medical Officer at the University of Kansas Health System. Back here today to be with you and happy to be back. We are joined today by Hawkeye, who's on vacation still, but not really because he keeps working through his vacation. He is in Florida, beginning to make his way back to Kansas City. We're going to turn to him for just a minute for an update. We also have a couple of very special guests. Justin Hoover, who's the Executive Director and the person who really developed the Battle Within and Frontline Therapy Network, which is working especially with veterans who have suffered from PTSD and medical and emotional distress as a result of service, as well as other things. I'm going to let Justin talk about that in just a moment. And the Clinical Director of the Battle Within, Whitney Logan. And Whitney, welcome to our program. And as well as Greg Nawalanic. Greg is back here to talk a little bit more about the psychological effects and the isolation that we all feel from COVID-19. But Doc Hawk, we're back open again as a country, as a society. Things are starting to return to normal, only not really. We're still seeing a number of increases in cases.
Yeah. Overall, that's scary. We know that in the nation itself, the cases are climbing. There's more testing. There's more people going out to get tested with the availability of all that. And so certainly in the nation, the overall case counts are climbing. And that's what we would have to expect when there's so many people who are still susceptible to the infection. And now you have the reopening. But there's still some things we can do to protect ourselves from that. Overall in the hospital, I think we've been doing pretty good. We had a little bit of a scare about a week ago where we had some higher cases than we normally had. Right now, we're sitting at 17 in the hospital with 8 of those in the ICU and 4 of those on the ventilator. So our numbers have held pretty stable over the weekend. Had a couple discharges, a couple admissions, no deaths. That's always good. And so that's where we sit right now.
Yeah, I know, and we had gone from 9 or 10 up to 19, and we were like, uh-oh, here it comes, second wave. And then it just sort of calmed back down again. We're still staying in that 15 to 20 range pretty consistently again. And what do you think's going to come now, Dana? What's out there?
You know, again, I think the other day I saw 2 million cases at least. It's probably over that now. That's still less than 1% of the total population. So you still have quite a bit of a susceptible population out there. And as people get to move and be around and go places, take the disease with them to the other places, you know, we said everything is just a plane trip away right now in our society and our world. And so I think that we just have to expect that cases will continue to increase. Now, I think during that time, we continue to have to watch the data that we have been watching, the rate of hospitalization, the case fatality rate, the infection fatality rate, if we can get that. And really take all of that into account. What I would most likely to see is, hopefully other health systems, other hospitals, other cities have done as we have done and really built up our amount of PPE and our important drugs and our ventilators and our hospital rooms so that if there is a further surge, we can better protect the patients and our healthcare workers.
Yeah, and my prediction is we're not done. We're still going to see these kind of rolling waves, which hopefully won't be a serious spike unless we see a breakdown of the pillars of infection control, which have really helped us so tremendously. Are you seeing much mask wearing down in Florida? I didn't see a lot of it down in southern Missouri.
Not so much. I did see a couple yesterday at the beach with the mask. When you get away from the tourist places and go to the shopping, a lot of the people there are wearing masks, so that's very important. But for the most part, the tourists really just don't seem to care and mask wearing is not important to them. But hopefully, those things can change. We just have to continue to hammer home the message and be the good example and wear the mask ourselves and do the proper hand hygiene and techniques and all that.
Yeah, I think if people get more concerned, then they'll start to wear their masks a little bit more often because you want to stay safe. Justin, speaking about staying safe, you had a couple of tours of duty, I think, as I understand, and you have 2 Purple Hearts. You're an infantry operator for a platoon in Iraq, and the second time you took a car bomb that led to your medical evacuation from the country, returned to the United States, and had a career in marketing and video production that made you feel pretty comfortable here in the studio. But then something took a turn in your life. Talk to us a little bit about how the Battle Within got started.
Sure.
What a great name.
Oh, well, thank you. It comes from a Cherokee proverb of two wolves, and so it's a story that we tell in our program. And really, the Battle Within was founded by over 100 veterans and first responders here in Kansas City to really help our nation's warriors, which we classify as veterans, first responders, ER personnel, corrections officers, and dispatchers, to really understand the experiences they've had, develop some integrative skills that can really set the stage for healing, and then provide a community to really help them go through that journey and have a successful outcome of that healing. And so it's been such a rewarding experience to have, to be able to offer what was once offered to me.
So talk to us a little bit about what was the decision that made you switch from marketing to Battle Within?
Sure. Really, it was lived experience. I came back from the war and got back to trying to live the American dream, really going through life suppressing all the things that I thought I was handling very well. About 10 years after I returned, 2016, my stepdaughter actually started having suicidality and depression in high school. And for me, I'll just say kids should never be in a war zone. And so all these things that I had suppressed all of a sudden really reared up, and I was having a hard time with it. My wife was the one that recommended, hey, you need to go find some help, find some services. And I started that journey myself, went through several different programs and therapies, and ended up working with a group that we came together to found the Battle Within. And really, we started with a 5-day program that is very experiential and brings warriors from around the nation together for free for a week. And it's an opportunity, again, really to understand and share your experiences, realize that you're not alone in those, which is such a huge part of why people don't seek help. They feel that these experiences, nobody can understand them, nobody can help them process through them, and there's a lot of shame in seeking that help. So really to have that atmosphere where you can reach out to others like yourself and discover that you're not alone and that there is a path to healing. With COVID, we weren't able to do our inpatient programming. And so that's very challenging to make that phone call to somebody that really you are their hope and starting that path to getting better. And so we came together and we said, what can we do? And that's where we reached out to Whitney, our clinical director, and started the Frontline Therapy Network, which is a referral platform where we are able to match our frontline workers. We've expanded in the age of COVID from ER personnel to all medical personnel because they're all on the front lines these days. And so we can match them with a clinician that we have vetted that has the experience and the education to support this population and provide them with up to 6 free sessions of therapy to really help them make sense of the chaotic world that we live in, help process through those things and continue to stay on their path.
So Whitney, you're out there on the front lines as well then, dealing with people who have issues related to the trauma from service and being a first responder. Talk to us a little bit. Has the isolation of what you're seeing in the world with COVID, what we're seeing with what you've seen historically working with your group, any similarities or things that has made this worse or better? I think Whitney's frozen on our screen at the minute, so I don't know if she's out there. So let me see if Greg Nawalanic is out there. Greg, are you there?
Yes, I'm here.
Okay, so I'm going to pitch that to you. Hopefully you heard that same question. Talk to us a little bit about some of the stress.
So I'll say this. We at the health system became familiar with the Battle Within and the Frontline Therapy Network when COVID had started ramping up. we'd had our own kind of in-house support that we were doing, just some support calls for our frontline staff. But we recognized that our clinical staff was already extended, with our own caseloads and our own, professional expectations that we had to fulfill. And so while this was something extra we were able to do, we really were hoping that there was something else that could take it that next step and give a more robust response. And so it was really a great benefit when we learned about this transition that they'd made to provide these 6 free individual therapy sessions for frontline staff, so our nurses, docs, anybody that was, out there, and obviously EMTs, all the first responders who were really getting put through the ringer while trying to manage the COVID outbreak. So it was really a great opportunity. And the thing that, to kind of really answer the question is, typically when people work in these areas, they expect the nightmare, to happen during their shift. When they go to work, destabilization and being kind of caught off guard is the norm. The problem that we saw with the COVID pandemic was that when they would go home, their home life, which is supposed to be your safe place, that was completely disrupted and upended because as much as loving support system members are typically there to counsel and support and non-judge and leave stuff out, we were seeing a shift where a lot of them were blaming and kind of casting aspersion on family members who work on the front lines because they were having to restrict their engagement and their going out in the world because they were exposed to people who were on the front line and making them higher risk of potentially spreading. And so when you wind up with that, you really, these frontline workers had no safe space. It was, very difficult at work, difficult at home, and trying to navigate that, you really just need the mental health support and a safe place where you can go and process these feelings and really talk through what you're experiencing. So this service that the Frontline Network and Battle Within has offered has just been a complete game changer.
Whitney, this sounds like, I think you're back with this. Glad to have you back. Talk to us a little bit about some of your work with the Frontline Network and the Battle Within, and especially about this impact of COVID-19 and isolation on veterans and first responders and people who we have turned to historically for service in the country.
Yes. The main thing that we are seeing from all the folks we're serving right now is that they are reporting a lot of increased stress and anxiety, some depressive symptoms. They are experiencing something really unique, like all of us are. So whether they're working even as a staff member at a hospital in administration, perhaps they're calling and canceling lots of surgeries and getting a ton of disappointment thrown back at them over the phone. Or maybe they're on the front lines working in the ICU treating COVID patients, or they're first responders responding to all kinds of different distress calls from folks and not knowing what they're walking into. And so we have this incredible team at the Battle Within and a wonderful network of therapists who have a lot of experience working with veterans, first responders, medical personnel. They have a lot of experience with trauma, acute trauma, secondary trauma, and we're able to get folks resources that they need quickly, conveniently. They can do them virtually. They're starting to be able to do them in person as well. And we've tried to just remove all barriers to treatment so that this service is free to folks who need it. And we've got clinicians that can see people at all hours of the day, all days of the week. And it's been really a wonderful thing to be a part of and to offer the community in Kansas City and beyond.
Yeah, that sounds like a really impressive thing. So Justin, how do you get funded?
We are very lucky that we have a lot of great support from corporations and individuals. Veterans United, Blue KC, Humana, there's so many that have allowed us to do this work that recognize that this is their opportunity to serve those that really serve our communities and serve our nation.
Yeah, I think that's got to be a great thing, and congratulations on the great work, and thank you to the great work that all of you do. So Jill, let's see first if there's questions from media this morning, and if not, we'll turn to our listening audience. So how about our audience?
Mallory wants to know, with society opening back up, what suggestions do you have for someone who is still terrified of going back out?
Terrified to come back to work, or to go back out, or to come back to work. Both things can be true. Whitney, what do you think?
Well, one of the things I talked a lot about in the work I've been doing with folks is that most of us have spent 2 to 3 months using hypervigilance in order to keep ourselves safe. And it's pretty hard to unwind all of that overnight. And so I encourage folks to do a few things. One is to stay careful and safe, to continue wearing your masks, to continue social distancing, to do excellent hand washing, to do your own kind of version of contact tracing if you are going to open your circle up a bit, just to see where people have been and what they're up to. Ask your employer about what they have available as far as mental health resources or support groups. I think it's really important to have practices that help you activate your parasympathetic nervous system or help you calm down. So whether that's breathing or walks outside or reading, meditation, mindfulness, those things are really critical when you're trying to shift from hypervigilance into some kind of renewed engagement with the world around you.
Yeah, those are important things. Greg, is there any way to kind of do a graded approach and come back in the world gently so that you don't have to go all at once?
Well, I think that this has been a really interesting situation, and I think that we're going to see research done on the psychology behind this reopening and just the general response to this. Because what I'm seeing is just within the last 2 weeks, it's like there's been a strange flip, though no real data or facts around COVID have changed. I think people hit kind of a point where they said, and I've heard people actually say this, I did what I was supposed to do. I did enough, and this is enough, and I'm going back out. And so it's like there's just this disregard for the proverbial wolf at the door, and people are just deciding, and I've seen a flip in the last 2 weeks where, if you went to go pick up curbside, if you didn't have a mask 2 weeks ago, you were the pariah. You better put your mask on because who would you be to come here and not have your mask on? Now I go pick things up and I've got my mask on, and people, are clumped together. They're not wearing masks, and they look at me like I'm the goofball for still wearing the mask. And it's really an interesting situation to observe how people can kind of create their own psychological reality around the threat. And I don't think that, the medical message has changed. I think that everything is still, supposed to be cautious, supposed to be distant, supposed to be wearing masks. But people have just kind of decided their own thing. So as far as the stepwise, re-engagement, I don't think that's a bad idea. I think that, I've finally, for the first time since March, made my way back to the supermarket with a mask, and not touching face and keeping distance, rather than using Instacart or any of the number of delivery things and then wiping everything. I still wipe things down, whether that's indicated or not. We really err on the side of caution in my household. But I think that a lot of people look at that now kind of as, and I think we're seeing the things have remained the same in terms of the spread. It's just a question of people's reaction to it. So, yeah.
Yeah, it's funny. I'll say I would have to share that observation when I was traveling this last week, and we worked really hard to stay safe, and we had the hand sanitizers and wipes and things like that. And we're traveling down. We went to a couple of gas stations. You get out, you fill up your car, you go in to get some water or something, and nobody's wearing a mask. And I'm like, gosh, nobody's wearing a mask. I'm wearing a mask. And you feel a little like the outsider to that. You feel a little like a pariah. As you said, I do think people have better hand hygiene than they normally do, but even that wasn't perfect. Then you get back in your car and you're back in your bubble. I feel pretty safe in my car, in my bubble. I get down there, I'm down in the Ozarks, have a cabin, feel safe. And you start going around anybody else that you see, and nobody really has on masks. And then you're out on the river and you're floating down the river and you're like, okay, I'm pretty safe. I'm in my bubble. You go back and forth throughout the day where you feel safe and then you don't feel safe. So as I turn to you back again, Justin, that had to be part of your experience in life. Sometimes you felt safe and sometimes you didn't feel safe. And man, it had to be hard to reconcile those two things.
Yeah, and I think, Whitney talked about the hypervigilance, and that's something that we saw a lot in the military is every time you go outside the wire, you are hypervigilant. And those defensives, psychological defenses that you build up to really keep you safe, but also you kind of develop because every day, you could get killed. We got shot at a lot. We got blown up a lot in IEDs. And so you just that's your new norm. And to see the civilian population as well, as there's this occupying army in there and them going about their daily lives, as you were kind of talking about it, that's how people process and they had to get on with their lives. And I think that's what we're seeing here. But you don't get to just turn off those psychological defenses. There's no light switch. And so that's, again, as Whitney said, having those practices, the meditation, the mindfulness, where you can really move to turning off the hypervigilance when you are in that safe bubble, because it's not healthy to have it on all the time. And that's where you see people really start to have a lot of hardship, is when they get in that mindset of, I'm never safe. I always have to have these defenses activated. And how that affects both you and the relationships in your life is very detrimental.
That's got to be hard. You and I talked a little bit about this before we started. Even with the concerns about police enforcement, police brutality, and the African American community, I'd say the African American community clearly doesn't feel safe around the police, and the police may not feel safe. And what a hard place for both groups to be in. Talk to us a little bit about how Battle Within can help with that.
Sure. So the Battle Within, during the protest, we were invited by the police chief to come to the command post during the protests and really be there and support those officers during that time. And for me personally, I mean, it was really, we weren't anywhere near the front lines. We were back kind of where, as people would rotate off the protest line, that's where we were. So we were in this safe place. It was kind of that place where they could take off the armor. And almost to a person, as they walk through the door and you ask, how are you doing? How are you doing? And I'm good. And that's pretty much the stock response I think you find in all these communities, because that's the response you need to give, because these aren't one-on-one sports, they're team sports. And so you are dependent on the other people in your group, and they have to be good to be able to continue to function as a team. But really, as you talk to them and kind of within 5 minutes, they're telling their hardships, their issues that they're having, how much they're struggling with this. And to be able to be there and be that safe conduit where they can really process those things in real time helps them have mature responses when they return to the protest line. And I think that's really the key part of, we need to have an understanding of ourselves so we can understand others, so we can have a constructive conversation to really find a path that is better for our nation and healing for our nation.
Yeah, these are hard times all around.
Debbie says her husband has an appointment at Leavenworth VA next Monday, and she's wanting to know if it's safe to go. Can you speak to getting back to health care?
Dana and I could probably take that on. I'll tell you, I don't think healthcare has ever been safer. The things that all hospitals are doing, and I know the VA is doing it just as we are, around trying to be safe and make sure you're safe in clinic, are extraordinary. And I think are making a difference for us. We're not really seeing any transmission of the virus within a healthcare setting, and I think that's a big, bold statement, but I believe it to be true here at KU, and I think most places would say that it's true. I know a lot of the folks up at the Leavenworth VA, and they'll do everything they can to protect the veterans that they serve and the community that they take care of. And I think that what we are doing, both by trying to make sure you stay safe, wearing a mask, your caregiver is going to wear a mask, lots of hand sanitizer, lots of social distancing, trying to block off chairs, making sure that you move through in a manner in which you don't come through with a lot of patients. Those are the key elements and the key pillars for making sure that folks stay safe, Dana.
Yeah, absolutely. The health systems, the clinics, the hospitals, all of these places, if they hadn't done before, they now have changed their policies, their protocols. All of their systems are geared toward keeping the patients safe and healthy and keeping their staff healthy. And again, we have been working on these types of systems and protocols for years. Over the last 8 to 10 weeks, certainly we have changed and they have evolved and they have become even more protective. And so I think certainly that the healthcare systems, the clinics, you need to get out, keep your other chronic health conditions optimally managed. You need to get out to these clinics and see your physicians and keep yourself healthy.
So important. You got to do it. You got to get back to healthcare. Otherwise, you're going to end up in healthcare, and you don't want to end up in that part of healthcare. You want to stay in that outpatient setting.
Marlis writes that she was around a child at an outdoor event, and then the parent was later diagnosed with COVID. She goes, "What's my risk for exposure?"
Wow, so she was only around the child, Dana, and we know that children may not be the big conduits or the vectors we thought that they might be. So there's so many sources of coronavirus out there. It'd be hard to peg that one child as being somebody who could develop a risk from that.
Yeah, absolutely. I think it's important to note, well, what was your interaction with the child? There are prolonged times. Exposure is typically 10 to 15 minutes or more in the general setting. But how close were you to that person? Being outdoors helps as well. So I'd agree. It's hard to really peg down what the exact risk is. If you were doing things that you were supposed to be doing, wearing a mask, obviously, if you're indoors, less if you're outdoors, but keeping further away from people, 6, 8, 10 feet is better. And using proper hand hygiene and not touching your face, you really should be okay without knowing the other details or circumstances of that contact.
Yeah, I think that makes sense. And again, don't touch your face when you're around somebody who's been sick, because you got to get it to a mucous membrane. And if you don't do that, wow, that really decreases your risk dramatically. Jill, other questions?
Allie wants to know, she wants you to clarify the wearing of masks when you're outside and social distancing.
And
is
inside.
it okay not to have a mask?
Yeah.
Do I only need it when I can't social distance, like when she goes to a big box store?
Yeah, those are great questions. And Dana, I think you and I have spoken a lot about if you're outside and you're more than 6 feet away from folks, you're in pretty good shape. It's hard to spread the virus outside a lot more so than when you're on a much more contained surface or a contained area, like, you're in a streetcar, you're in a bus, or you're in a crowded place like a grocery store, and you're around a lot of folks, in which case the mask becomes important. But the mask really protects other people from you more than it protects yourself. It does a little bit of that, but it really is protecting others from you. That's why it's so important that everybody wear a mask when they go into those situations, because it's a social responsibility thing. You're trying to protect everybody else from you. That's really the key to wearing that mask, right?
Yeah, absolutely. It's always about source control, because we don't know if you've had contact with the virus. Are you pre-symptomatic? Are you one of those lucky few percentage of people who may be asymptomatic throughout the whole course? And so it's important to know that you may not know that you've had contact with it. Keeping the source control, so keeping the mask on yourself, will help decrease the amount of virus that's expelled into the environment. And certainly when we know that 2 people have masks on, that will even more decrease the risk of the other person getting the infection as well.
Whitney, I'm hearing a lot of fear in a lot of these questions. How do people help work on that aspect of the whole COVID-19 pandemic and how they respond to it? What kind of things can they do?
Well, the emotional experience of fear comes up in order to try to help keep us safe. So fear is an emotion that asks us to get honest about what we're afraid of and then think through the actions we might be able to take in order to keep ourselves safe. Once we've done the things that we know can help us manage that fear or keep us safe, like wearing a mask, staying 6, 8, 10 feet apart from people, being outside, washing your hands, then you can start telling yourself you're doing everything you can, you're doing what the medical and scientific communities have told you to do, and it's okay to calm down. So there's a bit of self-talk that's required in that relationship with fear.
I'll just say, Dana, when we saw that study that was published about a week and a half ago in Lancet, I believe, where they looked at the different things that you can do to protect yourself, social distancing, the 6-foot rule, was number one, followed by the washing your hands, and then the mask, actually, as I recall, came in third. Still really important, but really it's all about that 6 feet.
Yeah, being apart from people is going to be the most important thing. And people were also wondering, I need an N95 to protect myself. That was part of that article as well. That's not true. If you can socially distance, physically distance, if you can be 6, 8, 10 feet away, especially outdoors, say on a driveway or something like that, if you're meeting up with a few friends or colleagues. The mask, certainly the N95, we aren't really needing, not really any more protective than a surgical mask. And these instances, outside of healthcare, things like that, and the hand washing and not touching your face as well. So yeah, agree. I think the physical distancing is really going to be the most important thing as we move through this summer.
That is really the key, and you don't really see people doing that as much. And I think it may be a little bit of lack of belief. And Greg, you spoke about it. You talked a little bit about having people wanting to go back out and they're around each other. Is there a certain need for that socialization that people just feel like they need to, and so they're just going to ignore the dangers?
I mean, I think that that's absolutely a piece of it. I know that people have, been reliant on Zoom and distant, get-togethers that really, I think, has been sufficient to sustain us through a foreseeable period. But now that we're seeing this spread into a more chronic and persistent situation that we don't know when it's really going to let up, I think people are so hungry for the connection. And I'll tell you, the things that we used to take for granted are so impactful now. Like, I shared earlier that I went back to the grocery store, and the simple, most common thing of just selecting my own produce was like a gift. I couldn't, and so the bar's been set low in terms of what really can fill us now. And so I think that, where people kind of were sticking in their own bubble, and now we're starting to kind of share bubbles. I would encourage people to try to maintain that distance piece and recognize that at least seeing face to face, not through a technological interface, is going to be probably enough. It's going to feel better than you think. Sure, it's going to remind you that, I can't just hug you and just be right there, but at least just being in the same relative outdoor space, that's a plus. And like we talked about, Dr. Stites last week, I think it's very important that families have these discussions around what is the family plan? What are we going to do? How are we going to respond to this? We see people making their own decisions. What is our decision? What is our comfort level with risk? And how engaged are we going to be? What are we going to do? Because otherwise, the uncertainty and wondering, well, what does my spouse or partner feel like, or what do the kids feel like, and what do I feel like? That's going to create more anxiety and kind of compound the response. Whereas if you can have a calm, goal-oriented discussion around what is your plan, that'll really help to alleviate at least one area of concern.
Justin, in your battle with your own PTSD and fear, you must have connected to a Greg or a Whitney. How did it go? What kind of things started opening doors for you to deal with some of the fear and anxiety?
Sure. Really it was having the clinicians in the 5-day program when I went through provide the context, kind of provide, here's the neurological why you need meditation, because that fight or flight increases your amygdala and makes you go to that fight or flight at an instant, and meditation can help. But really having the support of the other warriors across all the different professions, because I think it's very easy for us to be like, well, we're veterans, nobody else can understand them, nobody else has been in a car bomb or been shot at in this way, so nobody else can help. But then you have a police officer, EMS, a fire, an ER personnel that has varied experiences of how they got there, but they're impacted in the same way. Their families are impacted in the same way. That really breaks it down to a human level. That really allows you to understand that this is something that you can overcome, and there is a lot of people that can help you through that process. And also you have to own it, and you have to do that work yourself. So having a clinician such as Whitney that can help kind of guide you through that process along the way as you build your own support scaffolding is huge.
Now, think about building your own scaffolding to help find your way out so you can climb out of that fear and that angst every day.
Jan lives at the lake with her husband. They are in their 60s. They have underlying health conditions. They also have 4 children, 20 grandkids that come and go during the summer. They're wanting to know, is it too risky, or should we call the summer off?
Wow. Okay, Dana, here we go, trying to pass that judgment. Those are hard ones, aren't they?
Wow,
and we've talked about this before. There's this question about what is your level of risk and that you can tolerate in your life. Clearly, if you're down at the lake and you have a place, if your grandkids come to visit you and you have 20 of them, there's probably a decent likelihood that one of them will have had coronavirus, maybe not active. But you are going to run a few more risks. It just is. The question then becomes, what is your personal calculus? What's your own personal math? How much risk are you willing to entertain in order to do something with your grandkids? We were talking, Michelle, our interpreter, was with us before the program started about her dad and whether to take him down to Branson. And those are hard questions, and it's a personal calculus. The more that you can do to stay safe, stay in your own car, don't go outside, take your own food, prepare your own food, then you're going to decrease the risk. But outside folks coming into your bubble who you're not around all the time, that's just a little harder. Dana, what are your...
Yeah, and when you're dealing with so many grandkids and things of that nature, those bubbles just expand. I think that's a difficult question. I agree with you. We have to take into our own personal risk versus benefit of doing all of these things. The other things you can do is when you are at the lake, obviously, if it's nice out, you can spend a lot of the time outdoors. The meals, a lot of cooking will probably be grilling or indoors making the meals. If you can spend more time outdoors doing those things. There's also a smaller, I can't really remember if it was a Japanese or South Korean study that also looked at possible use of face masks in the household. That does help decrease transmission as well. It's a small study, but it's plausible for sure. So those are other things you can do. Continue to clean the high-touch surfaces. Continue to have adequate hand sanitizer and soap and water available for washing hands. And do all those things and really try to mitigate the risk as much as possible.
Yeah, I don't think there's a 100% way to do it. So, Whitney, I'm going to ask you the hardest question of the morning. We're going to play off this one. Here it comes. But I've given you prep. I've warned you that it was going to be really hard. So here it comes. So at what point, how do you judge if you're an individual? Because we can just talk about the risk of disease. But that need for love and connection, how, as an individual, do you know that suddenly you need, or maybe not suddenly, but somehow you need more of love and connection than fear and trying to keep yourself safe? Man, how do you do that? How do you know that as a human being?
Oh, it is a hard question, and it's one every single person I know is grappling with right now. The social and emotional toll of this pandemic is as great as the toll it maybe takes on some folks' lungs. And so when we are talking about how to manage ourselves and manage our mental health in this pandemic, it isn't just about your physical health. It's also about maybe your economic health, your social and emotional health. And so there's a lot of calculations that need to be made. I'm more extroverted than my husband, for example. And so I do more driveway hangs with neighbors, social distant walks. I let my kids play with other kids outside while the adults stay apart. And that has been really vital for us. So I'm still being careful, and I'm essentially doing a lot of contact tracing. I'm making sure I know people well and know what they've been up to. I'm certainly not going to get on a plane and go to Europe, to visit my sister who lives there, even though I miss her very much. And so giving yourself some safe ways to socialize or to connect with people that are important to you, I think is really vital, and that folks should be able to explore that right now, especially while we can be outside so much during this season. And there's no right or wrong answer, and there's no one size fits all. And I think that is why this stuff is so complex for people. It was almost easier when we all knew that the only thing we were supposed to do was stay inside and stay away from people. So this is tricky territory for almost everybody. And it's good to seek counsel outside of yourself, to listen to experts, but then also you have to have a way of checking in and really trying to figure out where you are struggling most. And at the same time, make choices that don't endanger other people. So, in every single conversation I've had with someone about how to manage this, the conclusions have been individual. Each person has a different way they're going to move forward. And yeah, so I don't have a great one-size-fits-all answer, but it's important.
It is important, and I think it comes down to some degree to just how sick you are, what your chronic illness is in a situation like that. If you have a lot of underlying illness and you're kind of always on the verge of needing to be in the hospital or out of the hospital, you're probably going to have to be a little more isolated right now. If your illnesses are a little more manageable and you can out, you can exercise, you can do things outside, the heat's not going to bother you, you can keep your family outside or a little more like that, probably a little safer, and that's probably how I would land. Jill, time for one more question today.
I'm going to put two together. One is Barb. She's got friends at Winterton, Georgia. She wants to know if they should quarantine. The other one is Alan wants to know, Doc Hawk, are airplanes safe to travel on?
Let's take that one. I feel like we've done the other one. So Doc Hawk, what do you think?
Yeah, I think we've talked about in our travels, obviously driving is safer. The airplane flight itself is probably going to be the highest risk because you are trapped in that small confined space for 1, 2, 3 hours. The airports themselves, I've shown video, there were a lot of hand sanitizer stations available. Most of the people are wearing masks. So plane flight, I think,
I know what he's going to say because we talk together so much. Plane flights are they're a little more risky, but you could do things to make them safer, and then it just becomes your risk tolerance like the rest of life. Yes. So let's turn to Whitney for a little bit of wrap up here, and any final thoughts you'd like to leave us with this morning?
The final thought that I have for the community of listeners is that it's important to prioritize all aspects of your health right now. And maybe in our modern history, we haven't had, in a time that like this where it's been so clear that how you're functioning impacts the community around you. And so every day is an opportunity to take good care of yourself. And that means following public health guidelines. It also means building a community that you feel safe processing your experiences with. Maybe it means getting a therapist that can meet with you virtually or in person or outside. Checking in with the people in your community, really considering what you need to feel all right and rested and restored at the end of each day. We're processing so much stress as a nation, as a globe. and it's so multi-layered. It's probably not wise to watch the news all day. It's probably not a good idea to sit around just telling yourself stories about how bad things are either. And so we've got to bring a little bit more attention into how we manage our day and how we manage our routines and how we manage our bodies and our minds. And in a way, it's an opportunity maybe to get good at those things for the first time. And that will follow you for the rest of your life, long after the pandemic is done. Those are good habits to have in place anyways. And so reframing some of these challenges as opportunities to learn new important skills can help you build the resilience that all of us are going to need.
Greg, any final thoughts today?
For me, I'm just going to say that I think everybody needs to remain, as much as we're starting to stick toes back out in the water and get back out to life, maybe we don't need to just dive headfirst in. And maybe, we track the numbers, we do this easily, and we're able to sustain a more engaged new normal. Rather than the fear I think a lot of people have of, if we go too hard, then we have to pull back again, and what that impacts in terms of financially and socially. So I think if we can remain long focused rather than short term and recognize that this is going to be an ongoing situation. And then the last thing I'd say is that as much as everybody, if they get a cough of any kind, everybody's going to panic. I think we also need to be checking in for the psychological coughs that pop up in terms of, wanting to eat crummy food, not wanting to get out at all, trying to avoid exercise, not wanting to get out of bed. Those are the warning signs that let you know that maybe it's time to make a call to a professional and really explore and try to enrich your social interaction.
Yeah, thank you. And thanks especially to Justin and Greg today for joining us. And Justin, your final thoughts for the day.
Yeah, I would say it's okay to not be okay. There's a lot going on in the world. I think everyone's looking for that expert opinion of what's black and what's white. And I think the questions here illustrate that. We're in a world of gray, but really the opportunity for you is to really build that resilience by owning your own decisions and reaching out for help. And as Dr. Craig said, finding when you need support and going out and getting it.
So a special thank you to Justin Hoover, the founder and executive director of the Battle Within and Frontline Therapy, and Whitney Logan, who's the clinical director of the Battle Within, who joined us today. And as always, the thanks to Greg Nawalanic, our psychologist here at the health system, and Doc Hawk, making his way back from Florida. We'll see you here in the studio tomorrow. To all of our listening audience, a reminder that tomorrow also we'll have Dr. Greiner with United Government of Wyandotte County Health Department and Dr. LeMaster with Johnson County Health Department, who will be talking with us about the numbers that are out there, what we're seeing in the rise, what that means, and Dr. Jessica Callender-Rich, who's going to talk about her work in nursing homes and assisted living and when they might reopen. It's just hard right now out there, and staying connected to the people we care about means so darn much. Whether you're in the African American community and you feel like it's not always safe to be around law enforcement. My kids are biracial, that means they're black. My son is black. Whenever he goes out, I'm always a little worried about how that interaction can go. And if I'm an officer, I'm probably worried about that every day with any interaction I have. Those are stressful settings and stressful situations. Getting the help to solve them is not a sign of shame. It's really a sign of trying to be healthy. I think in the long run, we all have our battles within. I love that. I love the wolf and the two different wolves that are within all of us. And I think we try to wrestle with those each day so that we can all stay safe. So I know we didn't get to all our questions today. We'll be back tomorrow to the Georgia question. I'm sure we'll take that on in the morning. And in the meantime, remember, there's still no place like home. We'll see you tomorrow.